All right, hello everyone, and welcome to the Health Sciences section of the GPS for Success Virtual Career Fair. We are so happy that you were able to come with us and join us today. This event was made possible through the hard work, dedication, and collaboration of Jefferson Lewis and St. Lawrence Lewis BOCES, WPBS, the Workplace, the Watertown Chamber of Commerce, Jefferson County Economic Development, and through the support of the Northern New York Community Foundation and Afgratech, who are the makers of AminoMax. A very special thank you to Jefferson Lewis BOCES for making this virtual career fair an absolute reality, and a shout out to Eli Stewicki, as he has been the backbone of this. We are so happy again that you could join us. My name is Celeste, and I am from WPBS. I will be the host, and your moderator today will be Shelly Fulkerson, and she is from Jefferson Lewis BOCES. Shelly and I are here to make sure that everything runs smoothly for this session. And your panelists today are, let me pull up here we go. Your panelists today are David Winters, who's from Watertown Audiology and Physical Therapy, Lisa Lagos, who is a public health educator from the Jefferson County Public Health Service, and Carrie Rose, who is a manager of talent acquisition at Samaritan Hospital. So thank you to them for joining us today. Here's how this session is going to work. Each panelist will be sharing different career options and possibilities in the health sciences career cluster, as well as some interesting facts about their industry that they think you should know. Now, once the panelist is finished, we will have a short Q&A session, but for right now, we are just recording, so we're going to present this information to you without questions. If you do have questions later, you can contact me at copito@wpbstv.org. My information is on wpbstv.org, and I can get you in contact with somebody. So without further ado, I'm going to hand it over to Shelly. She's going to introduce our first panelist, who I think is going to be David Winters, and we will get started. So whenever you're ready, Shelly, just hand it over to David and we'll be set to go.
Good morning, everybody. How's everybody doing today? I'm Dave Winters. I am the Business Development and Marketing Director at Watertown Audiology and Physical Therapy. We are a multi-practice facility based in downtown Watertown, right on Public Square. We have 3 locations. We have the main office in Watertown. We have a Syracuse office in Fayetteville, and we just opened up our 3rd office on Evans Mills, just outside the main gate of Fort Drum. Our office is comprised of both audiology and physical therapy. We have approximately 12 providers that have professional experience with audiology, physical therapy, hearing aids, and physician therapy assistants. So we have a wide variety of experiences and professional backgrounds that work with us. It's kind of a unique practice that we combine both audiology and physical therapy. To get into audiology a little bit, our doctors of audiology go to school 4 years past undergrad. They end up receiving the equivalent of a PhD, which is considered an AUD. And right now, there's about 70 schools across the country that do offer graduate programs for doctors of audiology. It is a very needed field for jobs. It's pretty much, once you graduate, you can pretty much go anywhere in the U.S. You know, jobs are plentiful, and there's just not enough audiologists right now to help keep up with the expected demand that's going to be rising here in the next few years. Right now, patients that they see, we see anybody from newborns all the way up to elderly patients that are 100, 101 years old, and everybody in between, anybody that has a hearing loss, hearing concern. We also work with children, especially that have hearing deficiencies or speech delays. We do provide testing for those. We also do provide hearing aids for both kids and adults, hearing protection to help prevent noise and hearing loss, because once you do lose your hearing, unfortunately, it is not you could just take a pill or some magic elixir that help you get it back. Once you lose it, it's gone. So we offer a variety of solutions for that on the audiology side. And the great thing about physical therapy is that we can combine that through our two practices that with audiology, because your balance is considered essential because it occurs in your middle ear. And we do the testing and assessment for balance. And if you do need therapy or rehabilitation to help you, get your balance back to normal or, strengthen, we do provide that on the physical therapy side. So that's how the two have kind of commingled together. And our physical therapists are amazing. They come back from a diverse set of backgrounds. We have orthopedics, concussion management, vestibular, which is also balance and dizziness, and everything in between. So the great thing about with the physical therapy is that we just see a wide variety of patients from both kids and adults. It's been an amazing experience, seeing recoveries from people who have been injured, whether it's a workplace accident, car accident, sports injury, or just simple, fell in the living room, tripped over something, to something else, and we help out with those conditions, and we like to get them back to what we consider to regain their independence. So the professionals that we have here for physical therapy, they do 4 years past undergrad. They end up going out with a doctorate of physical therapy, which is on the same level as an audiology degree or as a PhD. And you can pretty much go across any place in the U.S. It is a very in-needed field that you can do a lot of applications for working in a hospital setting, private practice facility like we offer, home settings even, or even traveling audiology or physical therapy that is provided. So there's a lot of different specialties and subspecialties to physical therapy that are offered, whether it's orthopedics, there's hands therapy, there's foot therapy that are co-specialties that are offered. We offer balance therapy, orthopedics, and even sports injury rehabilitation. So there's a lot of subspecialties that go into physical therapy that you can also consider the focus and make your living. Salaries are very competitive for both audiology and physical therapy. Starting salaries for both are roughly between $65,000 to $90,000, depending on where you go and what kind of location you're in. So that's how we have worked out very well. We've opened up 3 locations right now, and we work with all types of settings, all insurances, both military, non-military. We get patients from just a few hours away because of the services that we provide. So it's a great opportunity, and especially it's one of those fields that it's just it's going to be a very needed experience down the road, because a lot of our population that's in their 40s and 50s right now will be moving up, and baby boomers are there already. So there's just a big need, especially in rural areas. They're even more needed. So, but if you guys have any questions, you're more than welcome to reach out and email me. It's info@watertownaudiology.com. So I appreciate the time, Shelley. And if anybody else has any questions, or you can reach out to you or to Celeste. And we appreciate, hopefully you guys have some questions. Or we also do offer shadowing opportunities for both audiology and physical therapy, because we do take in students from local colleges and actually colleges from across the country to help train our future audiologists and physical therapists. So we are also a training facility for that aspect too. So very well-rounded practice, and we keep busy. So I appreciate the time, Shelley. If there's anything else, please let me know. Just some cool little facts about audiology and physical therapy is that, like I said earlier, audiology and physical therapy work together through your balance, works through your middle ear. Hearing loss is across the board. You can have it from birth, and it can be inherited, or not inherited, acquired through various means, whether it's shooting guns, being around loud environments, working in a facility that has loud noise. So there's a wide variety of aspects that hearing loss can occur. So we always encourage everybody to wear hearing protection, especially this time of year, cutting lawns, weed trimming, stuff like that. That's a big one. It doesn't take a lot to for it to go, but we have a great skill set of specialists up in the North Country that can help you with that. And we can help out with the audiology and physical therapy. So I appreciate the time, and thank you very much, Shelley.
Thank you so much, David. Next, we have Carrie Rose from Samaritan Hospital. She is the Manager of Talent Acquisition. Hello, Carrie. Oh, you're muted.
How's that?
Oh, fantastic. Perfect.
Sorry about that. Hi, everyone. So my name is Carrie Rose, as she said, and I am the Manager of Talent Acquisition at Samaritan Medical Center. So I think everybody hopefully knows who we are. We are the largest healthcare organization in the North Country of New York. We're affiliated with a smaller hospital called Claxton Hepburn, Clifton Fines, which, let's see, I'm sorry. How many employees do we have? We have 2,500 employees here. And the best part of working for the organization here is, I would say, we offer a lot of opportunities here, as far as we have over 1,000 different jobs. So it's not just healthcare, but positions that support healthcare as well. We do have MASH Camp, which everybody in your counties has access to, and we have students like yourselves, same age, come in. We do it a couple of times a year, and you can come in. Just this past one that we had several students that shadowed in our radiology department, and they would get to see and experience ultrasounds on pregnant women. We have you go into surgery, and we've had people that have observed with colonoscopies, different things like that. It's a very hands-on learning experience here, so that you really get a good idea of the different careers and the different things that you could be doing. We have people in our biomedical department, which is basically those people that all the different medical equipment that is needed to treat people, to, blood pressure cuffs, to radiology machines. Your biotechnologists are people that specialize in how to run the equipment, keep the equipment running, fix it when something breaks down with it. They do audits on it. You want to make sure that when somebody comes in and they're getting an EKG, that EKG is working. So we've got that as well. We feature that in the MASH Camp. I guess the reason why I'm talking about the MASH Camp is I think it's really important, and a great piece of advice for kids your age is, you spend most of your adult hours at work, you really want to like what you're doing. And I think it's really tough when you're young to try and figure that out, because you may like different things and not know where you want to spend your time going for school, for what you want to do. So I highly encourage everyone to participate in MASH camps, internships. We do internships here, job shadowing opportunities. If you think you know what you want to do, you can reach out to the Human Resources Department at Samaritan, and we are so happy to hook you up with somebody that you can job shadow to see if it's something that you like. I highly encourage that. I always like to tell a little private, my sister went to Nazareth College to become a teacher and spent 4 years of her time and money to become a teacher. In her last semester there, she student taught. She was already hundreds of thousands of dollars in, and realized in student teaching she really didn't want to be a teacher. So I guess that's why I know I'm supposed to be talking about Samaritan and everything. I'm a past teacher in my former life, so I like to encourage people to reach out to companies that will give you those job shadowing opportunities, those camps, those ways that you can experience it. You may feel overwhelmed when you get to the point that you have to try and figure out what you want to do, but there are people that are willing to support you and help you to figure that out. So don't feel like you have to have all the answers. If you think that maybe healthcare, or even something that would be a position that supports healthcare, whether it be, something in environmental services or human resources or a physical therapy, or there's just so many different things that we have here. Like I said, we have over 1,000 jobs. So please do reach out to us. Love to have you come here and shadow. We can totally support that. I would say the best part of working here is we do support furthering your education. We help you with that. As soon as you become an employee here, we want to support you to go as high as you possibly can in that career field. I would say the types of skills, interests, personalities that you need to be successful at working at Samaritan. The biggest one is compassion. I feel like no matter if you're working here in food services or you're working here as a doctor, we're all a family of caregivers. It doesn't matter what capacity you're working in to do that. Everybody here works as a family and has one common goal in mind, which is the best experience that we can give our patients and our residents that live in our long-term care facilities. Salaries, typical salaries, I mean, that really would depend on the career path that you go down. I mean, we have people that work here in minimum wage positions, and we have people that work here that are, making up to $500,000 a year. So it really all depends on the career that you choose for yourself. As far as being qualified to be a part of the organization, the only thing that you would have to do is I would encourage you to visit our company website, which is www.samaritanhealth.com. You can learn more about who we are, the several facilities that we own. We're not just a hospital, we're not just a medical center, but we have 2 assisted living and long-term care facilities, and we also have several different clinics that support different types of healthcare, as well as we have a cancer center, we have a women's center now. So there's a lot of different things that we do. And like I said, it's not just healthcare jobs, it's things that support that as well. You can always apply on the website. You can always reach out to the Human Resources office. Like I said, my phone number here, you can call me directly, is 315, what is my phone number here? 315-786-4997. You can get in direct contact with me to talk about job shadowing opportunities. You can get direct contact with me if you want to talk about one of our training programs. We have the Certified Nursing Assistant Training Program, the Home Health Aide Training Program. Those are paid training programs. If you're looking at breaking into an entry-level career in healthcare, that is the best way to go. We pay you while you're in the training, and then we put you in a position, and you get to, see, taste, touch, feel what it's like to be in nursing. If that's the career path that you're thinking that you want to go down, it's a great way to get your feet wet, decide. And a lot of people go on further from there to become LPNs, RNs, nurse practitioners, doctors. The sky's the limit. Why did I choose to work here? I'll wrap it up with that. I chose to work here because when I came to Samaritan to interview, as I was walking in to the building, I was stopped on 3 different occasions between the parking lot and the Human Resources office where I was to report for my interview by different employees who asked me if they could help me out, if I knew where I was going, if they could help get me there. There's something that we call the Samaritan experience here, and it really is true to life. When you walk down the hallways here, it doesn't matter if you're a doctor or if you're in environmental services and someone that's in charge of cleaning the facility. Everybody here walks down the hallway, makes eye contact with each other, smiles, and says hello. And that's something that everybody here exercises. It's just a very friendly place to work. When I say we are very family oriented with each other, I mean that. I work amongst a bunch of people that are very compassionate people, and it's definitely more than just a job. It's more than just a paycheck. It's very rewarding to work in this environment, no matter what career path you choose. And I'm here to answer any questions at any time. Like I said, I gave you my phone number earlier. I also have an email address, which is KROSE1 at shsny.com. I'm happy to answer any of your questions via email. I'm happy to take any of your calls at any time.
That is fantastic. Wow. So much information. And I know what you mean by that Samaritan experience.
Yeah.
Wow. I've witnessed it going in there myself. So I absolutely understand that. It's a wonderful place. Wow. Thank you so much for your time. Do we have Lisa on the line?
We do have Lisa. She's calling in, and I'm sorry if you hear a dog in the background. She's a little unhappy right now. She's calling in right now, so I'm going to unmute her, and we should have Lisa.
Hi,
Hey,
this is
Lisa, are you there?
Yes, can you hear me?
I can hear you. Yes. This is Lisa
Okay,
Lagos from Jefferson County Public Health, and you are the public health educator, correct?
Yes, that's correct.
Fantastic. Well, the floor is yours.
All right, thank you. So again, my name is Lisa Legis. I'm the health educator at Jefferson County Public Health Service. So we are the county health department for Jefferson County. And I'm sure probably at this point, especially recently, most people have heard of the CDC, or the Centers for Disease Control and Prevention. So the CDC is national public health, and then each state has their own Department of Health also, and then each county has their Department of Health. So we are the county Department of Health. So really what our goal is to prevent disease in our county, and we want to prevent injury also. So there's a lot of different programs that we do to help promote health and to educate people on how to prevent disease. Now I will mention quickly too, we are one of the very few health departments in New York State that also has a home health care agency attached to it. So our home health care agency, we have clinical staff that go into a patient's home to provide care. So we have LPNs, RNs, home health aides, physical therapists, occupational therapists. We have a registered dietitian on staff. We have a medical social worker, and all of those individuals will go into a patient's home to provide care for them. And the goal of that is to help keep people living independently in their home, so that way they can avoid the hospital and avoid the nursing home. So we have a variety of occupations available on that end, but I'm mostly going to talk about the health department since that's the part of the agency that I work in. So like I said, the health department, we really want to prevent disease in Jefferson County. So I'm the health educator. My supervisor is a health planner, and the two of us together, we do health promotion and education throughout the community. So we do different programs to help people reduce disease, and of course do education and outreach to let people know what they can do to stay healthy and prevent disease. And so the part of work that I like the most is that there's a variety of topics that we touch on. So we do vaccine preventable disease. So immunization is a huge part of health promotion as a county health department. So immunizations are really public health's biggest tool that we have at preventing disease because they are so effective. So that's a really big part of what the health department does. We do chronic disease prevention, lead poisoning prevention. We do radon and rabies, other communicable diseases in the community. So there's really a wide range of topics that we focus on. But that's also, I would say, the most challenging part of the job because there are so many topics. It's a challenge to try to stay up to date on all those different topics and stay current. So that way we're giving the most current information to the public. So I mentioned communicable disease. So what that means is it's a disease that is caused by a germ. So there's many different kinds. So most recently, probably the one you're thinking about is COVID-19. STIs are communicable diseases, tick-borne diseases, vaccine preventable diseases, foodborne illness. So the reason I mention that, we do have nurses at the health department also. And again, with recent events, you've probably heard of contact tracing. So contact tracing is something that public health has done for many years. And so if a person goes to a lab and is tested for a disease, if they test positive, that positive result is reported by the laboratory to a New York statewide system. And our nurses access that system every day. And when we see that there's a positive result in our county, our nurses will contact that person and start an investigation. So they're really disease investigators, which is pretty neat. So depending on what that disease is, the nurses will do different things with that patient. But what they do is they do an interview with them to try to determine how that person got sick. If we can determine where they got sick, then we can stop that spread to other people and help prevent other people from getting sick. So in the case of COVID-19, they would try to figure out how that person got the illness. They would also get a list of all that person's close contacts. So that way those contacts can be notified and let them know that they were exposed to the virus. But like I said, each disease process is a little bit different, but that's just an example. We also have an emergency preparedness coordinator that works here. So what they, as public health, we would hope that emergencies and natural disasters don't occur in our community, but we do have to have plans in place and prepare for those. So we have a staff person that does that, and they work very closely with other members of the community. So they have counterparts at the local hospitals. They have a counterpart at Fort Drum. So they're in coordination with those people. So we have a plan for the whole county together as one community. So again, that's important to mention at this time, with current events. Planning for a pandemic is something that public health does on a normal basis anyway. So we have those plans already in place. So there's really a variety of different occupations here at the health department. We have account clerks and secretaries. We have nurses, the health educator, health planners. So really, depending on what you're looking at, we employ people with a high school degree, people who have bachelor's degrees, people who have master's degrees. So there's really all different levels here at the health department. So normally, as the health educator, I would be going out to events in the community and doing education in the public. But of course, now we're not able to do any gatherings. So a lot of those events have been postponed or canceled. So we've sort of switched gears and are doing more education online and doing virtual education. So that's what my typical day used to look like. But of course now, because of the COVID-19 pandemic, really everybody's focus here at the health department has shifted, and we're spending a majority of our time working on the pandemic and stopping the spread of that in our community.
Some very good information there.
Okay. So I'm just looking at the list of questions here.
Yep.
So why I chose to work here. As a kid, I was always interested in health, and health class was my favorite. So I knew I wanted to focus on that and help other people learn about health and become healthier individuals. So I knew that I wanted to do that on a community level. And so that's what I did is I went to SUNY Cortland and I got my bachelor's in health science, which they now call community health. And that goes perfectly with public health. That's what I do now. And what I like about it is not each day looks the same. Each day is different. And, the topic changes, the environment changes. I go out into the community to different locations and can talk with different people. And it's interesting. It keeps it interesting. And, no 2 days look the same.
Thank you so much, Lisa. That was very informative.
Thank you.
Really appreciate your time. David, we really appreciate your time. Celeste, is there anything else for this session?
No, I think that's good for now. If you have any questions that you would like answered by either our panelists, myself, our moderator, you can let us know. There is a feedback form for the GPS for Success Virtual Career Fair on the registration page. If you would like to give us feedback, you're more than welcome. I hope that for the next one you can join us for hospitality and tourism. That's our next session. But other than that, unless anybody else has anything to add, I think we will stop the session here. I hope everybody stays healthy, stays happy. Please stay dry. There is a storm coming today, and I hope you can join us for the rest of our career fair.
Thanks. Take care, everybody.
Thank you.